to the dentin, Omega said it's very important that we fix the cavity, because if we don't fix it, baby, I said there's lines in the nerve, no? It's getting close to the nerve, which means that you will start to feel the pain. Somebody who has decay in the dentin can feel pain. Because I said, I see trauma, and I said, a cavity or possibility of having a cavity that's in the dentin. The third one is a pulp decay. It means that the cavity has gone from the enamel to the dentin, and now it's touching the nerves. The nerves of the teeth, with all your senses where you feel cold, hot, that is where the pulp decay will feel it. When you have a decay that has gone to the pulp, Omega said, let's do a root canal. I don't know if anyone has ever heard what a root canal is. Yes, it's not fun. A root canal means that they're going to remove all the nerves in your tooth so you don't feel the pain anymore. And then they'll tell you, put a crown on top of the tooth, because if you don't put a crown to secure the tooth can break. Pulp decay is very expensive when we do it. And see, if you're going to have a root canal, and if you were able to, So the pulp decay, which is the root canal cavity, is more expensive when they do it. Tubenya says statio yape wana kuhu dentist. Wan kuhu dentist na ne bo bedding. And the last cavity, is an infected pulp, which is when you have an infection at the roots of your roots. It's the same thing. So obia obenya infected pulp ubiano. They may tell you, sir, we couldn't do a root canal because we couldn't save the tooth. We have to remove the tooth. And see, that's what's an infected pulp. Okay. Another thing that I wanted to talk about is this. Attrition, abfraction, erosion, abrasion. If you look at your teeth, everyone suffers from either one of these. Attrition, they call it clenching or grinding. But you'll be wanting to, after some time, your teeth become smaller and smaller and smaller. That's what we call attrition. That first layer, it's because the person has grinded so much that we fall into the dentin. To call dentists, and they see this, they may tell you, are you grinding? Are you clenching your teeth? We don't know it, but naturally, stress. But and as you go to the gym, you work out, you pick up weights, you're clenching your teeth. This is stuff that can happen to you, and with age as well. Abfraction is my favorite one, and abrasion, because Ghana for brush it's me used to brush ding. This is what happens to our teeth when we brush too hard around our gums. We suffer from abfraction or abrasion. The middle part that you're seeing that is yellow is not because nipanesanayasa. It is the root of the teeth that is being shown. So when you fall into abfraction and abrasion, you can feel sensitivity to cold, to anything that is cold, or when you go to dental cleaning, you will feel coldness in your gums. That is because you've brushed too hard, you have removed enamel, you have removed what's supposed to protect. The gums, a protector, it has gone up. So your gums have now receded and you feel sensitivity. Erosion is also another thing. And cucumbers, lemon water, ginger, all acidity, it can cause erosion. Because, oh, but lemon water is good for my system. Yeah, well, it has an effect on your teeth. So it's not good when you have erosion. In that case, you have to make sure that you don't drink as much lemon water, drink regular water. There's also different types of fruits, vegetables, nutrients that you can eat that can bring your mouth back to a regular pH level so that your teeth are not too acidic. What to expect at your dentist appointment. For fill up a medical health questionnaire, because everything that you take it has a system in your body. And as I recommended Ruby Mawa, it can all play a role. So fill it medical questionnaire. We'll also do an extra and intraoral examination. We'll check your face, we'll check your jaw, how you close. Many different things we'll check in your mouth. We'll check probing of your gums. If I say, oh, gums, no, the instruments, gums, no, a free moja, and I said, we'll be able to tell you that this is not good or this is what you should be doing. We'll take x-rays to see, because maybe you're feeling something, but we can't see with the naked eye, so we need to take x-rays to see. We'll do a cleaning, and at the end, the dentist will come and examine your teeth. Risk factor assessment. So this is if somebody is suffering from diabetes, or if somebody is smoking, or if somebody has oral cancer, or if someone is taking medication. These are all things that can affect your teeth. So somebody who smokes can also increase the chances of having bone disease. Somebody who has diabetes, the healing time, maybe I could too, a chance on your gums will heal. Somebody who is older, they can't brush their teeth really well, so then they suffer from issues. Somebody who eats throughout the day, and every 2 hours, your mouth doesn't have the chance to go back to being neutral. Every time, every 2 hours, like cavities. And also people who take a lot of medication, you can suffer from dry mouth. The saliva now wasn't your pH level in your mouth becomes neutral, is dry, until you have more chances of getting cavities. And I don't know if they can show this video, but I guess let's go to the next one. And then tips to maintain good oral health at home is brush twice a day, morning and evening. You can use toothpaste that has fluoride, and to better toothpaste, making sure that it has fluoride. Making sure that it has fluoride ingredients in your toothpaste. Floss once a day, preferably nighttime, because so I did you the whole day, and nighttime also making sure so you use him and you brush your teeth. And if you're going to use mouthwash, that is optional. But if you will use mouthwash, make sure it's alcohol-free. And then interdental brush for periodontal disease. The samosha I said because the bone has gotten down, it leaves spaces between your teeth. So in that case, there's a different brush I was used to use him, but you will not know unless you go see the dentist. And then make sure you do 6 months checkup. Because 1 year and as a time say there was a cavity or something happening, you would not know. Dentist no. All of this is because the time between you didn't go to the dentist, so you didn't know. Now that you've gone, you've now discovered all these issues. So periodontal people who have bone disease, they might tell you 3 to 4 months, so earlier. Yeah, so that's all I have to say. Just take care of yourself and your mouth. Make sure it's that whatever you're taking that's going in your mouth is also going in your body. So, thank you.
Thank you very much, Sister Angela. Anka, you have the questions, no, a trick a cry. So for say. So for seeing the Rebbe Finty, Sister Angie Brana, so for Musa question back, what we want to do is say, few people are coming to present, but they are not coming to present the whole program like Sister Angie did on the man a special platform. And you are be presenting only pathway to get to the program. We are near Busa questions in NT. So for me, no one Busa or question, Sister Angie and Sanafi.
Adabedasi. This Angie, there were 3-in-1 questions. Number 1, about education, you know. If I show you a 3-year program now, award Ben Yadima, is it diploma or degree?
It's a diploma.
Diploma,
yeah.
Okay. And the course involved, general overview. Maybe within 3-year program, no, the person is going to spend maybe 50,000. 60,000, so you're a resident, and that's why you're international student. So
I think that if you're a resident here, the tuition is cheaper.
Okay.
If you're an international student, it's more, but it's not as much as the rest of Canada, how much you would pay.
Okay. So can you name a price, maybe?
Oh, I don't know.
You don't know? Okay,
I don't
thank
know
you.
the schools, yeah.
All right. My last question is about the mouthwash.
Mm-hmm.
Is it before brushing your teeth or after brushing your teeth that you use a mouthwash?
So mouthwash contains fluoride, usually. So I personally do flossing, brushing, and I'll do mouthwash at the end. Either way, the mouthwash is not enough to do anything. The best things to do is to floss and brush. Mouthwash is an additional thing because it won't go remove plaque. It'll just reduce the bacteria in your mouth, but it's not going to go and remove how brushing and flossing would do.
Okay, so one more. How can I floss?
I had a video, but I don't think they could play it. So the first video is brushing.
Brushing your teeth is an essential part of your daily day. And when done properly, leads to a healthy mouth and smile. Proper brushing should take at least 2 minutes and be done twice a day. Using a soft bristle brush and a fluoride
paste are recommended for removing plaque from your teeth. To follow the correct brushing technique, start by tilting the brush at a 45-degree angle against the gum line. Using short, back and forth strokes, gently brush the outer, inner, and chewing surfaces of the teeth. When cleaning the inside surfaces of your front teeth, make sure to tilt the brush vertically and move your toothbrush in up and down strokes. Finally, make sure to gently brush your tongue to remove bacteria and help freshen your breath. Remember to replace your toothbrush when it begins to show wear, or every 3 to 4 months. You should also change your toothbrush after you have had an illness. Keeping a regular toothbrushing routine and using proper brushing technique is one of the most important things you can do to keep your teeth free of bacteria and reduce the likelihood of tooth decay.
So that was the video for brushing. The second one is for flossing. The more kind of say more yaren so if you are cold and I said you like toothbrush na no essay I was so sound with toothbrush. It's very important.
following the proper toothbrushing technique. Flossing is another important part of complete dental care. Flossing allows you to reach and remove plaque and food particles
under the gum line and in between your teeth where a toothbrush can't always reach. Plaque buildup can lead to tooth decay and gum disease, so it is important and recommended to floss daily. To follow the proper flossing technique, start with about 18 inches of floss, winding most of it around each middle finger so that about 1 to 2 inches of floss is left to work with. Hold the floss tautly between your thumbs and index fingers, sliding it gently up and down between your teeth. To get beneath the gum line, gently curve the floss around the base of each tooth. To prevent cutting or bruising your gums, do not snap or force the floss. Make sure to use a clean section of floss as you move to different teeth. When removing floss, you can use the same back and forth motion to bring the floss up and away from your teeth. There are multiple varieties of floss available. Consult your doctor on what type is the best fit for you to promote your oral health.
So that was the video on flossing. There's different types of floss when you go to Pharmaprix or Jean Coutu, but it depends which one you're more comfortable with. Go with what you know you'll be able to use. If it's the one with the stick, go in.
Okay. Okay. We said the name CIA program. Some more questions there, but then we need the rest. I know so this is also very important. Then we will do the rest later. Mr. Ross said, "Wow, question no." And I'm saying, "Yes, streaming to person who no question into we any Muhammad." Now we will a question na yes star answer. Into Mr. Wow question biano. We will say na waba emuni who say o participate in your show.
Thank you. Thank you very much, Angela. Can you please recommend a few of the toothpaste on the market, taking into account the tooth sensitivity and the fluoride whitening? Which of them should we go?
So if you have tooth sensitivity to cold, I would recommend Colgate Pro Relief is for sensitivity, or Sensodyne toothpaste. The thing is, if you want it to work, when you brush your teeth, you spit out and you don't rinse with water after. Because the minute all the fluoride and the ingredients that's supposed to stay and protect your teeth will all be off your teeth. So brush with either one, Sensodyne Pro Relief for sensitivity that has fluoride. Spit and don't rinse after with water.
And what's the best time for me to scrape my tongue?
After you brush.
Thank you.
Can I do that? Thank you very much. Mine is a follow-up question. You said we should spit, we shouldn't rinse.
Yeah.
So can I swallow in case there is a saliva
So
in my
it's
mouth?
fine because the percentage of the fluoride in the toothpaste is very little. As long as you spit out most of the excess, keep the rest on the teeth is fine. You can spit out, don't rinse after.
Okay. Thank you very
It's
much.
gonna take you time to get used to it, but
Okay, thank you.
it works.
Angie, my question is, you kuromo no. Na ye the body tray, body tray. And a juicy yes. But now no, every toothbrush have a plastic.
Okay.
And they are saying that there's microplastic. If it goes to our bloodstream, it's caused so much danger. Will you be able to say something about that?
So far, there's many studies that we hear. For fluoride even is something that we hear, but it's fine. It doesn't cause any issue.
Oh, it's fine.
It's fine.
Oh, okay. Thank you.
Manjim Pacho, yen tetremano, how should we clean our
The tongue.
And what me the any sharp object are you very swan? Is it good to do that?
So for tongue cleaner, You could either use your own toothbrush, which you choose with me, I use toothbrush to clean your tongue, or they have tongue cleaners in Pharmaprix or Jean Coutu, where you can use it. It looks like two sides. There's one that has the same brush texture, and the other side is plastic. And so you use the brush side, you use the plastic to remove, and you'll see all of it. But there's tongue cleaners specifically, and you can use your toothbrush.
Right, thank you.
Thank you, Angela. My question is, when it comes to toothbrushes, is it recommended to use a regular manual toothbrush or an electric toothbrush?
Okay, so for manual or electric, it doesn't matter which one you use, as long as you're using the same technique that you brush with. Because how you use electric toothbrush, or cleaning, I mean, who difference because nipani use ye. So a regular toothbrush, use a regular toothbrush. I use a toothbrush that has a soft bristle. And ko use the tree washroom, and yes, our gums do not be saying. So use a soft bristle toothbrush and an electric toothbrush. There's many good ones out there, like Oral-B. It has a small head, and Philips. But don't add any extra pressure because the electric toothbrush already has force. So that's what it is.
Okay, thank you, Angie. My question is, because of the video you sent of the direction of flossing, is there a specific way we should be flossing? Does it matter if it's up and, I think in the video it was up and down.
Yeah.
Does it matter up and down or side to side?
So before you floss your teeth, you glide in back and forth. You rub one side of your teeth, you rub the other side of your teeth, and then you slowly come back up. So you don't want to force in, and yes, you can actually hurt your gums. So gently slide in. Once you feel you're in, you rub one side, like a C shape, and you rub the other side. And even if it bleeds, it's fine. Still do it. With time, it'll reduce the inflammation.
Actually, mbese mibisa wo say, me ya babawa no. Me ya babawa no. Me da, me sorry a. Menu me tintesu a moja mam. Me ba abrewa me tintesu a bonse ne moja wo. Me so me ni cavity. Ena me nya ma so bia so. Nti ede nti ne ma ne basa.
So inflammation and acid bleeding once again is linked to plaque. Sa bacteria na nebe mausin anaso gams na a free moja. So in that case, the technique now we use today brush, you're not directly putting the toothbrush close to your gums enough. And flossing, you're also not rubbing enough because the gums, you have, the gums look like little U shape. But all the floss, we are so bad like clean news.
And
flossing. That's the problem. If you don't floss, your gums will bleed when you floss. You have to floss.
And I just say, Baba, Jimmy toothbrush now try, Mamma. With the baby.
Mr. Angela, I say. Especially, me say, me book our dentist. Last year or so, 2 years, because spending about 6,500. I want me say, and so still. Last 2 weeks, he said, I'm so problem, me no other chrono. And person will say, Diana Mene. Almost catch them who specialist say,
for gum specialist.
Gums, and I'm insurance, no, I won't to make train say. A best year, I'm going to make a bear 1 year, name inquiry. All catch them some but to make try my insurance now because my over me limit no into me trauma a year and son of
Okay.
And I feel so passion, but some say. At times I brought no almost out of one to chew almost. One to chew, but did you and sana? Because I bet at times was one of power to know, or did when I finish eating, then I'll go brush my teeth. So why? Yeah, you come there was allowed to chew. I know better to so better dear you could chew. Also, I shall now about to chew or about what did you answer? I didn't hear.
Good. And see, also I book up our dentist because I'm a referral I call gum specialist. And see, gum specialist, maybe you suffer from bone disease, and baby our clinic now, maybe they don't treat bone disease, and see, they probably sent you to a periodontist. a periodontist
And what
to
them
go
call him?
and
Ne boarding, Papa.
Ne boarding, pa, but it won't here because one, yeah, you can lose teeth. And his periodontist, no, he goes deep into your gums or a deep cleaning.
Was it lazy? So said
Laser
yeah, laser,
treatment
okay, laser, yeah.
to remove tartar that's under your gums because all of that, no, you can't reach it. It drew baby, cleaning. See, when you go to a specialist, sa tartar free gums, and I say, hey, yeah. But I was
But now me dentist na me ni problem.
and
I'm
I'm
insurance. I'm clean. I'm starting all this problem. But now me dentist na me be kama.
And I made sure say we di kan ka say wa nkwa unhu ebia na wo hodada but na wunnim ukọ enia ye hu sa problems we nyina. And I question and it was second one. No. Yes, they brush after they eat breakfast. It's not a problem because at the end of the day, they will have teeth cleaner for the rest of the day. Whereas if you choose, but it's up to you. Me, I don't like that. I personally brush. If I have to brush after I finish eating, I will brush again.
Okay.
But brush first if you want to eat, but brush again. Yeah.
Thank you.
Okay. So I say Busane say no dental issue be a bit me health a bit my health problem be.
If you already suffer from a health issue and you have dental problems, it can also be a problem.
Okay. And last one so you kind of say tooth extraction like
Extraction?
Yeah.
Mm-hmm.
And remember and I say time Ben say bibi how with me too because last time I call dentist but I wasn't feeling any pains there but I'm catching me say so too best 4.
So it was wisdom teeth.
Wisdom teeth.
It was your wisdom teeth?
Okay, yes,
I don't
wisdom
know
teeth. Yep.
Yeah. So wisdom teeth, wisdom teeth, when you go to the dentist, they check the angle. X-ray. Big X-ray. They call it a panoramic X-ray. We check to see where all the placements of your teeth are. They're missing permanent teeth, but they never knew. And that X-ray will show us if nipani need a replacement of teeth or if there's any issues in your bone. Maybe when you went, Gabby, your wisdom teeth are placed in a way is affecting the one in your teeth. Because sometimes wisdom teeth is not straight, or there's no room, or it's knocking a healthy tooth. In that case, it's important to remove it because it can cause, if there's an infection, it can cause problems to a healthy tooth. And the wisdom teeth, they're your last teeth. So they're not important if they leave. However, if you could choose na SCB one chain has say, maybe I to the one fin that's a problem because naturally with time your teeth will move forward because there's no teeth in between. So your teeth will move forward.
Thank you.
This is my last question. Thank you. These days, when you go to Jankutu or wherever you buy your toothpaste, you usually see different kinds of toothpaste. Some are with charcoal, others none. Professionally, among these two, which of them can you recommend for us? Is it the charcoal or the one without the charcoal toothpaste?
I wouldn't recommend any. If you want to get a tooth whitening and you go to the dentist and they tell you, you don't have any issues, you're perfect, and you tell them, I'm interested in getting a teeth whitening, they will tell you, maybe, you know what, you're a good candidate for teeth whitening. They're too sensitive, but almost but how? Because products now it will cause you more teeth sensitivity. So maybe you're not a good candidate for teeth whitening. But the charcoal and all of that, they don't make a difference. If you're gonna use, make sure it's a toothpaste with fluoride. If you are a good candidate for teeth whitening, now try whitening, like you can use Crest white strips to start. It's maybe around $40. You can try that, it works. It's not gonna work right away because dentist I will give you proper syringes that it'll whiten with quicker time. But if you want to try and you are good candidates for teeth whitening, almost Friday will be Crest whitening strips that you can use.
Thank you very much, Sister Angela, for the presentation and being able to answer our questions adequately to meet our needs. The next part, Edrus, how we did the program, they say, Nanti Angela, be presenting the to say the way ya come. There were other programs that present a whole program be presenting the pathway to get into the program. And you see a movie per se change careers. You movie per se 5 different pathways. And there are a few pathways that you bet me consider. And engineer, you invite a plumber and a construction person to come and give us a way to get into these programs and take it too long. DEP programs and ASP programs say, yeah, me fancy beer. Na me a teacher, me a nurse, na mpesa okay. Me be before 4, it be take me shorter time, like 18 months, 2 years. What do I do? And I say, me person me go school, but skasem nintin. And I say, if I want to do psychology, it's going to take me 5 to 7 years. Be me pay be a year, and son and what do how do I go about it? So these are some of the vocational education programs. You bet me a short time, but also it does give you a lot of income. Ghana no be a construction, no be a roof, no be a carpenter. So but here no, those are the career path and asset professions. My year nursing or college, I be university, but be a plumbing and answer, be a electricity no. My salary no, some wise no in a way, simply because they work for companies and they also do side jobs, which give them a lot of money. And in himself, Pastor Busa question regarding Angie program, no, how much it will cost. International programs at the DEP vocational schools level and college level, no, mostly it ranges between $28,000 to $40,000 dollars per program. No, Memphis say Avalon provided electrical cost. The electrical program, no, if you are not a Quebec citizen, you pay around $28,000 for the program. But that is not the biggest part, because when him say there are programs demanding construction, plumbing, electricity that you would definitely get your money back. Yeah, and it's a good investment in your future. Last time I program now be multiple thing. Quebec and I say North America and one thing, it's me multiple thing which help us. But before I may go into that now, there are other 2 professionals person presenting the pathway. And my friend Auntie Ruby, no my friend Auntie Jessica, I'm present my pathway we are near Busa question the DPs no at was. Madam Massey.
Okay, so I'm going to be talking about nursing. So I'm supposed to talk about the pathway and what I did to be in nursing. So I started in high school. In high school, the classes that I had to take, I had to do chemistry, math, science, and obviously the other classes. And then I went to CEGEP. So here in Quebec, Montreal, we have something called CEGEP. And in CEGEP, I did 3 years for nursing school. Then after CEGEP, I went and did my bachelor's. Bachelor's was 2 years. And then also right now I'm continuing to do my master's. So as a nurse, you can work in many different places. At my job, I do home care. So I go to people's houses and do the nursing service at their house. But before that, I was working in the hospital. You can also work in ICU, emergency, nursing homes. You can do so many things like management, teaching within nursing. The grade that you should have to be in nursing would be, I would say, around 75 to 85%. It's very difficult to get in, but as I said, if you get good grades within those different areas like math, science, and French and all of that, you can easily get in. If I have to talk about salary, okay, so I guess I can give approximate. I'm going to give approximate. So if you do, I'm so sorry, from CEGEP. So from CEGEP, you will be called a deck nurse. So when you do CEGEP, you have to go do your licensing exam. So every year we have to pay about $569 to renew our licenses. So that's around, CEGEP level is about 50 to 75,000 yearly. Clinician is when you go do your bachelor's, that's about 75 to 95. And as you go up, it goes up, but in general, that's all I have to say about nursing. Thank you.
Thank you very much. And the know can say, be a member so free Ghana and by we are sciences. We are also a different program. You can also meet the prerequisite. I have a high maths, secondary 5 marks. It is a trigonometry, Ghana Sania can into or trigonometry. Now algebra, umiti prerequisites no. And sister, yeah, we are will be a question that will be to me a busa from Honey Hanimina, the must. Our CPA.
All right, so I'll be presenting on becoming a CPA. First and foremost, you'll do your high school. CPA, a Chartered Professional Accountant. That's what it stands for. There's different types of Chartered Professional Accountants, but we'll get into that a little bit later. And so in order for you to become a CPA in Quebec, you will go to high school. When you're in high school, you will have to choose high math. You don't need chemistry, you don't need physics, but you do need high math. Then you will go on to go to CEGEP. In CEGEP, if you want to do accounting, there's 2 different options. So you can choose a pre-university program. That will be 2 years, and after that, you will go to university. If you want to do a career program, you can also do accounting technology. That is a 3-year program, and when you finish, you can enter the job market right away and work as an accounting technician. That's an option, but that is not the one that I took. So I did the pre-university 2 years in CEGEP, and after that, I went on to do my Bachelor of Commerce with a concentration in accounting. So that bachelor's is 3 years that you will do in university, and when you finish, you graduate with an accounting diploma. And that allows you right away to go and start and work as an accountant for any company in any industry. However, if you want to work in public accounting means that you're working for the public. That is whereby you need the CPA license. And so the CPA is almost kind of like a master's, where you will do another 2 years after your bachelor's degree to become licensed, to then either you can get licensed. There's 2 different paths of CPAs. So there's CPAs that are auditors, and there's CPAs that work in tax. And so if you're a CPA auditor, which is what I am, what you do is that you verify financial statements. So Yemfa company be to say Amazon. It told oh, Amazon for almost stock at $20. Or person almost stock or almost stock cost or almost stock from. What auditors do is that we go into Amazon and we look at their financial documents to say Amazon was scanner omo kaso omo wano anase omuni. And so we go in and we certify financial information. That's what auditors do. For the tax CPAs, they also go in and they validate the tax information to make sure say all these companies are paying the appropriate taxes that they should pay. And so I think that is what I had to say. In terms of salary, when you graduate with your bachelor, your salary is around 50 to 60,000, I would say, with your bachelor's in accounting. Once you do your CPA, you usually jump to around 75 to 90 once you have your license, and then as time goes on, with the more experience that you earn, the higher you go. Now, once you are a CPA, there are many opportunities where you could work. If you work in public accounting, you'll be working with different companies validating different financial information. A common misconception people think is that to be an accountant, you need to be good at math. I keep saying it's not true. You need to ask good questions, and you need to have an analytical spirit. So if you're someone that likes what Ghana for would call inhuhemu, like someone cannot just tell you, oh, I made $100. How did you make it? Where did it come from? If you're the type of person that likes to understand information, that likes to inspect, then it would be the right career for you. So I think that's all I have to say. Thank you.
Thank you very much, Sister. Yeah. Other ones, no, my own someone per se or more ever presented. But I'm coming back with the vocational programs. Yeah, you move brave. Although say be your profession, you bet me aside those vocational programs, no, to invest in our future and to also help us with our stay, maybe in Canada or wherever we go. So most of the common vocational programs, for men can be cooking. And most of these vocational programs takes less than 2 years. It takes less than 2 years, mostly 18 months, 20 months, 16 months. And your BB to say even healthcare professional, your PAB, which is also considered as a vocational program, which takes 8 to 16 months, depending on the level. Carpentry, one of the vocational programs. Electrician, one of the vocational programs. Construction, plumbing, one of the vocational programs. You will say, Wabaha, na we are citizen, and as work hearing that it's like almost free. Say, work hearing na when you raise or see a jewel. Your Pearson Park, Pearson Education Center, Bakon LaSalle, any old week, West Island Career Center. Ningine schools are affiliated. And into see a jewel to napa so it be very quick. Maybe you're in more Ghana before we continue university see at the within 1.5 to 2 years. These programs are very, very interesting, but at the same time, no, it's very lucrative because so we electrician or how you pay 7 prayers sometimes will be our university cronto and now all those things, you know, pay career change, you know. These are your Avalon College. Avalon College is almost like international. And you was Canada betria to say sometimes people most of these schools offer the option of even payment. And if you feel say money is a problem, there are few institutions, I know Passage is one of them, that give loans to almost international students to be able to pursue their career, and afterwards you pay back. The loan, the interest rate is a little bit high, but at the same time, investing in your own life, it comes back to the point to say you will not lose anything. At the end of the day, it will be a win for you because you'll be doing something that maybe you love, earning, and at the same time, you will be also in your life, it will be a point that you see, say, you have attained something. Maybe I'm trying to bridge it now. So also, do you want to present your program? Okay, Brian, let me start a question. In the Sister Anwani, Sister Jessica, any dear Macan, why question if you're a bit me, I be directed to the right person.
Okay. Okay, Sajimai, my question is, you were talking about like vocational programs. So for basically for the newcomers, I guess, do they have to take French classes prior to enrolling?
Mais c'est on dit en étant Québec, il faut que vous parlez un peu de français. Alors, si vous faites les programmes ici, il faut que tu parles un peu de français. Just to say, your vocational programs, no, it is electricity, it is plumbing, it is construction. We are, yes, also we are French exam. We are free be OQLF. OQLF near basic French. Yeah, tailored to your profession. In the chroma say one young one as one high school program be a professional program piano. I was say we are French. Maybe I no maybe I had 201. Me go school kakra ha ba me we nursing program. I'm saying one high school and two the French certificate into so okoye. But French nye say the say is so hard no. I just tailor to your program. Ghana will be say chew poor pass forget. Into learning terminologies no in that field no acquire them who pass we are your Quebec thereby you must be me my year almost all the way even in nursing no mostly in English sector and I mean share in here French no. And my French in it's a small French that you write tailored to your profession. If you work on company before sometimes you don't really require the French. Meaning, so we be best also and answer.
My question is a general question, and education day. Me person me bisa say, me say eja, met me a chere me ba say, me who sister Ruby adwuma wo ye no, me ni je ho nti me person da ache wo ye say adwuma ni bi. Ana se brebe ena se me hunu se akwada na okọ school no daachi adwuma sei na obeye se me hunu ya se me tunwa na mo because aha na menya nwe Ghana unemployment doso e onipa bebre o ma wie secondary school but okọ school nya na onim nia obeye wa wie school bisa say school na akọ na de na pese o ya onim ti brebe na se me hunu se akwada na okọ school no daachi we no pese wo ye zami hu ya metimi atu hu anamon na media chente sa obewie school no abetena fie wa abra wonya hweye ana se mia metimi apebi aman force se ko school ni wie na beye we.
Thank you, Elder SK. I think it's a really good question. First and foremost, what I will say is say, as a parent, I think it's very important to say you will make sure that you have a look at Obano's skills. And so, etnya chenchia say this person is doing this job in Siwonsu Koyebi. Ohe Obano's skills are maybe they're very, very friendly, omo penipa. Then, you put that aside. Maybe Obano, they're really good at, reading. They love English, they love reading, they love writing, they're very creative. And so make sure still you as a parent, you pay attention to their skills, you pay attention to what they're good at. When you go to parent and teacher meetings teacher for Nankasabekacha say, oh, Obano, obe school, yeah, the way manual, obey in 10 or yeah, deal way home, or yeah, deal way home. So I think as a parent, make sure that you take the time to actually spend time with your child, analyze them, look at where their interests are, look at what they're good at, and I think that will help you. The second thing is, for every single high school in Quebec, they have what we call Career Day. Mekaise Mewa High School, every year, Omo Brewo a piece of paper, no much Bisao say, listed 3 ejuma, ojo say, when you bejeho. Then you spend 1 day with them. And so I remember the first time I said, I need nursing home. And I call emergency overnight shift. I cried the entire time I was there. And nursing, I don't think so. and then mame is switch. So I think those different opportunities. Now I remember I also did law, so I spent a day with the lawyer to see how I would enjoy that. And so those different opportunities, na ebe boa kwalano amane who say, oh, I spent a day with a lawyer, I spent a day with an engineer, I spent a day with a construction worker, a plumber. I enjoyed it, I did not enjoy it. This is what I liked, this is what I did not like. That's the second point. And the third and last point I want to emphasize is that as the world continues to go on, one thing I've noticed is that we don't know of it yet. People are always creating new things, new opportunities. A social media influencer, a few years ago, we didn't even know what that was, but they say, and so be open to new ideas. It's not only the jobs that we hear of or the jobs that we see that are available to our kids. So let's not limit them. Let's make sure we pay attention to their skills, their strengths, their interests, and based off of that, they can tailor something that will help them in their purpose. So I hope that was clear.
Hello. My question is, Ekoma Jesine Anwa. French na mente. Me pese me tena Quebec. But me say me mo profession ni bi. Is there any way I'm meeting me and navigate it through? Second question, Ekoma Elder Ajimai. Elder me pacho what kind of schools for in Sano Juma? I'll be happy to say ube more and more details about schools now near me, you know, especially the more loans, you
know. Say major more question and my answer comedian because we're more ha. So when you are born here, automatically you pick up the French easily. And the government have a lot of programs to help immigrate here back Quebec. There are evening programs. And so me 6 to 8:39. And they can also pay for you. French immersion into 2-3 years, if I'm correct. Then we are French and Quabain Bemauska. Asho Banya, the Obenya Bebedia Manifi. And into most of the time, I am per se a beer, Yabeko school, because scared of Bemano. Mekoyeg may be a now community be a 1,005. Now me quatna French, them na a beer was meaning in Oma Bemame 1,000, which is small, but Sister Anwaka, you are investing in your future. And Tihano to French, you say Canada bilingual. So I call other provinces now what French, what English. Every job, no, you are the first pick. Like you be the most pick. Mekoya recently wore New Brunswick who say, me betina hache mensuya, but mensuya kakrano kra mensuya ebuai. And there are evening courses, there are TV shows. There are government programs that can help you. And I think so we can give more information section on that. A vocational program, no? Okay. Your PAC, Pearson Education Center, your WIC, West Island Career Center, and your Avaron, your many different ones, depending on what you want to do, you must specialize in. But I say them can say, why are you there? What call here and near Joa? Most of these places, no, the program is almost free. To say park, adult centers, no. But Avaron there, to say almost say private school, you have to pay. But any scar, now say government one, it is same accreditation and recognition. And I think say they depend on specific program will be personal. There are a lot of people here who knows the path we are. You bet to me as it's one-on-one now if you have clarity on the individual programs. Madam I say. May patrol be a question from the dentist hygiene to the presenting him people no also but be most program now starting to into me and into be a questioner for today's program from the dental side to the air a kind of whole ubitimi ebisa. So we answer any question, then maybe we will try to bring the program to an end. As of Paul, about you with me about any muka crame because you say you know we video. Madam was we are now Uncle Kenneth so they at Wasso.
Maybe media no any question and kasa de bet as a bisa and I'm pese bisa is a so no ye mo bisa the person who say okay say wo and then nipa bebre wo had more professionals e wo yaso mu pa na me see da ben nka e betimi aye day bia sa professionals e whatsapp fu nyina no mo betimi open me beti say small cabin so on say we bo ha na fe asafoma no ankasa no nanka yensusu ye wuwuram ni ye check ni ma ni ye hwe ba bi ehia se obi akobia na se bisa bia so nanka obisa na etimi aboa bia hu se yenso ye wade ndiye bi se me question na me bisa da ben na mo betimi aye because ya na mpanifo ka bi se konfo a oso obekom badwam no mpanifo se ya so ndi esi etimi ye bibisa na yehu sa nyema bidamase.
Yeah, that's opening Paul. I think say yes, I share a movie. This is, I think, one of the first year in this church history, education department. And in Timinim saying Amia do Muntino, a free summer equi, move huye. Na yani aguman so momo ya beti na yan twas nyame ebe hu ya mabo near in a sana shin the end munyam ti samai move huye or ase ho and I say even outside with the community. Yeah, that's it.
All right, so my question is, me free Ghana naba, me what different background, and I be a person going into nursing, and I'm going to accounting, but my mistake to nursing, right? Me what business background, me person me go into nursing, but me need the nursing or science background now, ebe qualify me ma apply for school. Is there any institutions or more offer prereqs? Me to me aye, and I mean started from high school. Na me sign ko.
Well, as open Kenneth, I think so. Maybe a hybrid in America some more. Maybe I me Kumasi High School. Then now I say science and name. But you have to evaluate your credentials. And your Quebec government attestation to evaluate your credentials. And I say, free and by you works. WES, World Education Services, it may evaluate your credentials. And either you use the Quebec government one or worse, you will see, so okay, nursing prerequisite near high maths, high science. I can high maths, high science, I can chemistry, biology, trigonometry, and algebra. Yes, I need him no Ghana. And you watch high maths, you can about trigonometry and algebra. And into say, oh, why in ancient way? Or make me like oh, here so chemistry of solutions can home, any be awake biology, anatomy can home, na what convert na odi a room. And to certificate be a crowd free Ghana. Baby, we are 5 years, say, a high school, say, a university. No. When you evaluate her, it puts you on a higher level because so talking about where you can do the prerequisite. No. Maybe I made the AB or Dawson. Wait me in a Concordia and Miguel. But one time who you say, so we are prerequisite to college. All the colleges there's a prerequisite. One course will cost you about $150. But as I will jump to university now, so a prerequisite now. One course will cost you between $1,200 to $1,500. And for me, it's not about so me co university prerequisite. No, if you can do them at the college, financially it makes sense to do them at the college than to do them at the university. Now, so you run university straight to, so you run college straight to. Now, the minimum say, answer question. And every prerequisite can be done in high school when it comes to maths and sciences. Chemistry of solution, basics now. wait me any even in high school. When it comes to higher ones now, college level, Dawson, John Abbott, Vanier, higher French. André Laurando, higher French in Tiniani pay English ones no. Enti anase McGill or Concordia, enti depending on baby our motor no sikawo. Who is come out there with me as university for prerequisite. But I see case for the CJEP level no ebeboa medas. Any question and I say, upon you know Ken's impact with me abba.
If I say me was course no it be age limit na.
The I think some of the obusan say we international person abaha at the fancy a free Ghana by say me evaluation of my courses man using for 10 years I have to redo them. And only age limit at me minimum. But the why no Chrome had the limited the enemy we are higher continuously. Why a chemistry limit in him. Oh, okay. Chrome Hardy 70 years now person started course to be a bit to me. I think say baby I went to me after 45 in military. Audit for see after 60 went to me and sign audit papers. And I think say for a human fee or general work need to me ko baby. But a bit to say military, almost age range, any police. But the I can most of the audit or say after 60, after now, you can still work, but you cannot be signing papers. And Jihana mostly flexible, say, when you crown and woman be bro, happens or ya, which me shall say, and osa a. Young friend, oh, ne maame wa ha ọbẹ ansa ama o.
Auntie Becky here. Okay, Angela Naba. Angie, mi bisa se kane no se obi kasa na enka wo nanum a sent wo nanum a yese osia pro ntia me pese me bisa sa de no ene sia pro no ewo ibi asa na.
There's so many things that can give someone bad breath. You know, no. It could be either, like I stated, tartar, plaque, bone disease. When your gums are inflamed, it brings a smell. The smell of blood in your mouth, it all can bring a smell. See, it goes back to the same thing. Brush around the gums, floss your teeth. If you want to use mouthwash, use mouthwash. And get cleanings professionally. That all can help in keeping a good oral health. So that's it.
So, opinion is why and sinus issues and sit me my bad breath. And say Ghana will be or ha, ya na my tie one him and crano and also it's me at the side issue. But to be out say obi or and see if it Ghana, yes in a number a sinus issues. And so I can't. And I'm near the floor here already as a Christian. We would like to thank you for staying Yeah, na ebacho. So what you stream, you know? Yeah. Okay. Yeah. My one thing I'm observing is say this year, no. We say we want to give information, we want to give knowledge, we want to help ourselves. But every time I hear program, no, whether a church program, whatever, we are. Most of the people, yeah, and yes,